book I have chosen to talk about is The Four of Us, a family memoir. It was written by Elizabeth Swados, and it is a book that shows the life of the Swados family as it deals with mental health problems, specifically schizophrenia. Elizabeth Swados is an American writer, musician, composer, and theater director. In the book, Swados describes her family as one riddled with mental disease. Her paternal grandmother had schizophrenia and actually had a lobotomy. Her mother was diagnosed with depression but showed many symptoms of schizophrenia. Her brother Lincoln is who the book is centered around. Lincoln was diagnosed with disorganized schizophrenia at the age of 19 during his first years of college at Stanford. He was found running across campus naked, covered only with the remains of a pizza. This would be the first of many psychotic breaks for Lincoln. This would also be the first of many times he would be hospitalized throughout his life. Their father, Robert, did not believe in the idea of a mental illness at all. He believed behaviors and actions of his son and wife were intentional and of their own free will. He believed they were trying to sabotage his career as a successful attorney. When Lincoln was 21, he attempted suicide by jumping in front of a subway train. 10 years later, their mother would take their own life as a result of her severe depression. Robert would later find out there was nothing that he could have stopped his wife from taking her own life. He was told then she was schizophrenic, but was never given the diagnosis while she was alive. Suicide and attempts at suicide are fairly common with schizophrenia. According to the textbook, at least 15% of people with this disorder will attempt suicide in their lives. Schizophrenia is a psychotic disorder in which personal, social, and occupational functioning deteriorates as a result of strange perceptions, unusual emotions, and motor abnormalities. Lincoln always had severe problems with personal and social functioning. He didn't communicate well with others, nor did he get along with people in general. As he got older, work also became a problem. He eventually became a street performer and ultimately died on the streets. He had a serious problem with his emotions, and when he actually displayed these emotions, they were never what they should have been for the situation. There are three groups of symptoms for this disorder: positive symptoms, negative symptoms, and psychomotor symptoms. Positive symptoms are pathological excess and include delusions, disorganized thinking, speech, and heightened perceptions, and hallucinations, and inappropriate affect. Lincoln suffered from all of these forms of positive symptoms. He suffered from delusions of persecution, and that he would always accuse his sister of plotting against him, accused his father of plotting against him, and accused his father as treating his sister better than him. There was also many times when Elizabeth would have a musical or a play do really well in the theater, and Lincoln would become enraged at her for trying to steal his glory, that he would actually call the critics and editors and tell them that she actually stolen his work. He suffered from disorganized thinking through derailment. Elizabeth was 8 years younger than Lincoln, and she states in her book that he suffered from derailment for as long as she could remember. Elizabeth tells us in her book that Lincoln often complained about hearing sounds coming from every direction, and it drained him. He would often be exhausted from the sensory overload. Lincoln suffered from auditory hallucinations for much of his life, which took place through hearing the devil telling him to kill himself. Throughout the book, the only emotion Lincoln ever showed readily was anger. However, when he did show other emotions, such as happiness or sadness, it was never an appropriate time. When his mother committed suicide, he showed absolutely no emotion at all, even though he was very close to her. Negative symptoms are pathological deficits and would include poverty of speech, blunted and flat affect, loss of elation, and social withdrawal. Along with the positive symptoms of inappropriate affect, Lincoln also suffered from negative symptoms of flat affect, showing almost no emotions. There were many times Lincoln would withdraw from society as a whole. He lived out his entire adulthood in a filthy little storefront in the Lower East Side of Manhattan, and there were many times he would hide out in his storefront for days or even weeks on end. He wouldn't answer the door, he wouldn't go to work, he wouldn't answer the phone. He would just shut out the world completely. The course of this disorder usually follows three phases: prodromal, active, and residual. Prodromal is the beginning. This is when a person may not have the obvious symptoms of the disorder, but are the beginning to deteriorate. This is when they may withdraw socially, develop strange ideas, or express little emotion. Lincoln appeared to be in a prodromal stage very early on in his life. He would often show signs of social withdrawal, create fake characters, and actually live as the characters. And he always had very little emotion. The active phase is when symptoms are obvious, and this usually triggered by something stressful in a person's life. It was during his freshman year at Stanford when Lincoln finally crashed into the active phase of this disorder. He had his first psychotic break and ended up hospitalized for quite some time. This is when he received the diagnosis of disorganized schizophrenia. Lincoln would remain in the active phase of the disorder for the next 27 years until his death at age 46. The last stage is the residual stage. This is when some of the active symptoms lessen, but some of the negative symptoms, such as blunted emotions, will remain. These phases can last for days, weeks, even years. Recovery or moving into the residual stage happens more often for those who function well before the onset of the disorder. To receive a diagnosis of schizophrenia, the DSM-4 TR states symptoms must continue for 6 months or more. There are 5 patterns of schizophrenia: disorganized, catatonic, paranoid, undifferentiated, and residual. There are also 2 types of schizophrenia, type 1 and type 2. Disorganized schizophrenia, the central system of confusion, incoherence, flat and inappropriate affect, attention and perception problems, extreme social withdrawal, odd mannerisms, and grimaces. This was Lincoln's diagnosis. The central features of catatonic schizophrenia are psychomotor disturbances such as catatonic stupors or catatonic excitement. Paranoid schizophrenia is an organized systems of delusions and auditory hallucinations that may guide the life of the patient. Those who do not fall into disorganized, catatonic, paranoid, or residual schizophrenia are diagnosed with undifferentiated schizophrenia. Residual schizophrenia is when the symptoms of the disorder lessen in strength and number but yet remain in residual form. Type 1 schizophrenia is dominated by positive symptoms such as delusions, hallucinations, and certain formal thought disorders, and is believed to be linked more closely with biochemical abnormalities in the brain. This is what Lincoln appeared to have. Type 2 schizophrenia is dominated with negative symptoms such as flat affect and poverty of speech and a lack of volition. And this is linked with structural abnormalities in the brain. Biological theorists point to genetic, biochemical, structural, and viral causes. The genetic view is supported through studies of relatives, twins, adoptees, and molecular biology. We know from the book that there was a family history of schizophrenia for Lincoln. His paternal grandmother had it, and so did his mother, though she was never given a clinical diagnosis until after her suicide. The leading biochemical explanation states that the brains of the people with this disorder, mainly those with mostly positive symptoms, may contain abnormally large number of dopamine receptors, especially in the D2 receptors. Brain imaging techniques have also discovered abnormal brain structures in many people with this disorder. Throughout much of history of mankind, those who were diagnosed with schizophrenia were considered to be beyond help. This disorder is still very, very difficult to treat. But with this discovery of antipsychotic medications in the 1940s and the new methods in therapy, those with schizophrenia stand a better chance to ever survive with this disorder and live a functional life. The purpose of antipsychotic drug is to help correct grossly confused and distorted thinking. The best known conventional antipsychotics are Meraril, Haldol, Stelazine, and Prolixin. These drugs are shown to reduce the symptoms at least 65% of the patients with schizophrenia. In most cases, the maximum benefit is reached within the first 6 months of treatment. However, if the patient stops taking the medication too soon, symptoms can return. These drugs tend to work better on positive symptoms of the disorder than negative symptoms. Lincoln only took medication while he was hospitalized, and Elizabeth never mentioned what particular medication he had taken while in the hospital. There is now a newer class of antipsychotic drugs called atypical antipsychotics. They get their name atypical because their biological operation differs from that of conventional antipsychotics. These drugs are received at fewer D2 receptors and more D1, D4, and serotonin receptors than the conventional antipsychotics. The most effective and the most widely used atypical antipsychotics are Clozaril, Repsodal, Zyprexa, Seroquel, and Abilify. The atypicals appear to be more effective than the conventionals, helping 85% of the people with schizophrenia. The atypicals reduce positive and negative symptoms, cause fewer side effects, and are now considered to be the first line of treatment for patients with schizophrenia. When used in combination with medication, psychotherapy can be very successful. Lincoln wanted no part in any type of treatment. He never believed there was anything wrong with him, so he refused to go to therapy, which worked out well for Lincoln because his father didn't believe in it and refused to pay for it. There are many factors that will determine whether someone with this disorder has a good chance or a bad prognosis. According to Dr. Cheryl Lane, PsyD, and schizophrenia.com, the following things can lead to a possibility of a good diagnosis of a paranoid schizophrenia: being female, no family, having fewer negative symptoms, shorter periods of active symptoms, acute onset, a higher level of functioning prior to onset, a good support system, taking prescribed medications as directed, and access to therapy. A bad prognosis can come with an early age of onset: being male, having a higher number of negative symptoms, having a family history of the disorder, and having a low level of functioning prior to onset, a history of substance abuse, and have little or no support system. Lincoln would have to have a pretty grim prognosis. He was male, had a very strong family history of schizophrenia, had a low level of functioning before the onset of the symptoms, and he didn't stay on his meds when he wasn't in the hospital. He didn't go to therapy, he had no support system, his active symptoms never left once they set in, and the onset of his symptoms was slow. In the book, she mentioned many times that he always lived in filth as long as she could remember. He had no desire to have any type of good hygiene. She went to his storefront apartment once to recover some of his papers. She was struck in horror when she saw the way he had been living. She stated it looked like a degenerate madman lived there. His writings had become incoherent notes scribbled on torn pieces of paper. Everything was filthy. There was cat food and cat litter all over everything. As she looked around, she thought about the way he had to fight, the chaotic courses, movies, and soundtracks in his brain just to hold on to the brief moments of clarity that were rarely allotted to him. His lack of hygiene was always a problem. It would make their mother cry, and her tears would enrage their father, and Lincoln would refuse to talk to Elizabeth. Oftentimes he would sneak into her room at night, pounce on her to wake her up, poke and pinch her through the covers, and ask her why she was turning their parents against him, especially when he loved her so much. There were many times he would do this and would choke her to the point she would almost pass out. She never feared him, though. She knew deep down that he would never hurt her, not intentionally. As a child, Lincoln went to a very upscale private school and was eventually kicked out because of his behavior. He had a very serious problem with authority of any kind. He would fight with and actually strike his teachers. He drew obscene things on the walls of the school. He would often go to class dressed in some sort of costume and refuse to use his normal voice. He was even caught running naked through the chapel of the school. When his father transferred him to a huge public school, he seemed to thrive. He always had rapid shifts in his moves and would often disappear and end up too disorientated to find his way home. So one of the maids would have to go fetch him. Lincoln wanted more in life than to become a very well-known literary figure. When he would struggle with his writing, he would become outraged and very violent. He would smash things in his room. Once he screamed at his typewriter because it was stopping him from writing. When it didn't speak back to him, he became extremely angry and threw it out the window. Another time, his beloved record player started skipping on one of his favorite Frank Sinatra records. He yelled at the record player and accused it of trying to keep him from listening to his favorite song. When the record player continued to skip, he smashed it against the wall several times and threw it out his window. Lincoln died at the age of 46. The autopsy showed severe intestinal blockages, a tumor on his lung, severe emphysema, and heart disease that was very advanced for his age. Lincoln never took care of himself. He lived in each moment and lived his way his schizophrenic mind told him to. In her book, Swaddle portrays schizophrenia as a miserable, self-destructive, life-shortening disease rather than one as a romantic response to an insane society. Lincoln always believed he was the normal one up to the day he died.